Great. Well, thank you all for having me here. Heather, do I switch the slides myself or you're switching it from me? I do it myself? Okay, wonderful. Well, that's a hard act to follow because I can only dream to be at the scale of Moms Rising, but maybe one day. So what I'm going to share with you today is a snapshot of an ongoing project that started just about a year and a half ago in my backyard, South Omaha. And the concept of this is really to try to find the strategies to marry youth advocacy with social marketing and partnerships to create a Latino health movement. And the premise of this is really twofold. One is there's a dearth of interventions that focus specifically on Latino youth and Latino families in the realm of obesity prevention. And then secondly, a lot of the public health interventions that are adapted for minority or low resource communities often fail because they are not responsive to the level of community readiness. And so we did some initial research and we found that there's a huge disparity in Omaha between Latinos and non-Latinos in terms of how they perceive childhood obesity. And in Douglas County, which is where Omaha is seated, a quarter of the Latino residents do not see childhood obesity as a big problem. Compare that to only 6% among the white residents in Douglas County. And in addition to a lack of awareness, there's also very low levels of perceived leadership, a poor community climate, and very little mobilization of resources in South Omaha. And these are based on a well-validated community readiness model, which really is the target, the outcome of our project. So what I'm going to share with you today are some of the strategies that we're testing and deploying to hopefully shift the needle on some of these dimensions of community readiness. So the initiative was designed to develop youth activists to enhance community readiness to address obesity and diabetes in Omaha's Latino community. Our idea at its core is to empower families to make healthy choices and to create an environment that is conducive to those healthy choices. Very importantly, it is youth-driven and community participatory. And the reason for this is because we believe that this will enhance the long-term community ownership and hopefully the sustainability of change. And very uniquely, it's at the outset of this, it was very uncomfortable for me as a scientist, to think about doing a project that is not your traditional, biomedical, research. And the idea of marrying art, multimedia in science was very intriguing, but also very risky. Capitalizing on just what Monifa has said, we believe that this kind of a media environment is crucial to catalyze a social movement about Latino health. So if Heather, you could just play a very quick video of the mural, which is one of the projects that our students actually did last year. This was a community event where we did a mural at a public launch event. If you want to just scroll to the middle 10 seconds, and then we'll play the last 10 seconds to not waste any time. So it's a two-story mural that some of the students actually did, and they're street artists. And so we capitalize on their unique talents and work with them to design the project. Now, the students had to actually come up with the whole branding, the logo, everything about the project, the strategies that are being deployed, they have to actually participate in the development of. And so I can assure you that everything takes 8 times as long to develop and implement, but in the end, I think it's really worth it. And the brand, the logo, the name of the project also has meanings, and there includes 4 motifs. So the able part of saludable stands for attitude, balance, leadership, and energy, which fortunately work equally well in English as well as Spanish. And very importantly, as we basically 6 months into the project, then we started to really think about, okay, if we're going to continue to do this, how do we actually make this sustainable? Well, one approach, one important strategy was to find ways to basically institutionalize this effort. And so we work with the Omaha South High School, which is the only high school in South Omaha, the predominant Latino community, to basically incorporate Saludable as a project within their service learning curriculum. So this is an established curriculum already in the school. We're basically going to the school and say, we don't want you to do anything extra, but can we offer ourselves up as an initiative that every year students entering into the service learning program can potentially choose to take on and work with us to develop, strategies and initiatives throughout the academic year. And so this course called Characters in Action, students actually meet for half an hour every morning, 5 days a week. And through this partnership, we're able to begin to embed ourselves into the school environment without having to go to the school board and create a whole new curriculum, which in Omaha is extremely challenging to do. So in addition to that, linking up with the local wellness coalitions is also very important. So Livable Omaha is the primary umbrella organization in Douglas County that serves as a leader along with the county health department on initiatives like a CPPW and community transformation grant, et cetera. So this type of strategy to basically allow ourselves to become a part of the existing infrastructure and existing institutional climate is an ongoing process, but I think very important to the long-term viability of the initiative. So just give you an overarching view of what we're doing. There are basically 3-pronged strategies. I will show you in a minute our online presence, but this is definitely a very focal point for our campaign. And we're on Facebook. We have a very interactive, multimedia-driven website. This coming year, we're going to be adding to our web presence with a youth blog, as well as an expert log for parents. So we're going to create a parent page with a nutritionist and a pediatrician, kind of like a Dear Abby type blog. And hopefully we can also add a few podcasts throughout the year on healthy cooking. So one of our partners, or a couple of our partners, are chefs in the community. We're going to continue the school project. Last year we did a Green as Go campaign in the school that was led by the students in the Characters in Action course. And basically in that particular campaign, they tried to improve the cafeteria environment by both educating, working with the food service staff leadership to educate food service staff on what they should be telling students, to consume, to eat, as well as creating traffic light labels for the various foods that were offered in the cafeteria. This year, they're going to continue to expand that activity, hopefully get into the convenience stores, the concession stands, in other venues of food within the school environment. Later in 2013, we're hoping that the students will actually take Saludable Omaha to the lower grades, which they have done for other projects in the past, so it wouldn't be something new, but we certainly think that spreading the message to the younger students in elementary and middle school could be very powerful. We have a neighborhood campaign, and the focal point for the neighborhood campaign this coming year is going to be getting ourselves into the school-based health centers and the educare centers, and very importantly, to actually really begin implementing our business campaign. And our goal is to hit 25 local restaurants and / grocery stores where if we basically have a short menu of strategies that these businesses can opt in. And if they create one change, they become a Saludable activist. If they create 2 or more changes for their customers, they become a super activist, and then they get a certificate that they can advertise in their store or on their window. So that's something that we're going to be doing. And all of this is to basically increase the participation, the enrollment in our quote unquote movement, and increase awareness about the issues and about our brand, and hopefully begin to really start mobilizing the leadership and resources within this particular community. And this is based on a framework that will surely be coming out in the CDC Journal of Preventing Chronic Disease. The idea here is really to integrate locally, but as well as nationally, because this is really a shoestring, project to date. In order for this to be sustainable, we got to become a part of a larger connection, larger network. And so I think that that is key to a lot of these academic center initiated, projects, to think about how we can actually become a component of much bigger movement in order to really survive, because this kind of research is not generally well supported through existing funding mechanisms. So the challenge, before I show you the website, some of the challenges I would say for us is this is extremely resource intensive project. Managing social marketing, managing social media takes a lot of effort, and you got to be on it on a daily basis. It's not typical research, therefore there are implications for funding. It's very difficult to capture the attention and the time of minority youth, so that's very challenging. And again, these questions of sustainability that I have referred to already. So some of the key partners I just want to highlight, and Catherine Stewart from Comms Evolution has been really a superb leader for our creative team, and we've been fortunate to receive a little bit of funding from the RWJ Foundation in the Nebraska Research Initiative to build this work. So let me now switch over to the website, Heather, if you can. The first tab, please. So you can see that our website is meant to be very graphics driven, designed for low literacy. And if you scroll down, Heather, please. I will just play this first video on the right-hand side, swag.
Hi, I'm Lucia Rodriguez, and I am part of Saludable. As Latinos, we celebrate that we're the fastest growing minority. But here in the state of Nebraska, we're also the fastest growing diabetic and obese community.
Hi, my name's Andrew Martinez, and I'm from Omaha, Nebraska. Only 26% of Latinos exercise daily, and that has to change. Our attitude towards exercise needs to change. Our balance between diet and activity also has to change.
My name is Laura Magaña. I am from Mexico and I live in South O. I am taking part in Saludable because I want to help my Latino community better their health.
Hey you guys, I'm Jose Antonio Barrales. I'm originally from Mexico City, Mexico, and now living in Omaha, Nebraska. I am Saludable.
My name is Grace and I'm from South Omaha. When Latinos come to the United States, it actually leads to unhealthy eating for them and their family.
When our parents moved to the United States, they focused on giving us what they didn't have as children, and accidentally overfed us.
Cultural eating is what's making our young Latinos overweight. And by cultural eating, I mean eating high-fat foods in respect to our friends and family.
That's not good.
But I want to change that by instilling the idea of moderation and smaller portions.
Hi, my name is Danny Readiness, and since I joined Saludable, I have way more energy than I did before. I feel great. Let me throw this at you. 44% of Hispanic teenagers, like myself, are overweight.
In the last 2 years, the percentage of Hispanic women who are overweight or obese have gone up from 30% to 70%, and I don't want to be a statistic.
We need to get that number down to something we could be proud of.
Hi, my name is Crucito Alba. I was born and raised in Omaha, Nebraska. Growing up as a Hispanic American and seeing the many struggles that not only my family but my community has to go through due to the fact that they are overweight, obese, and unhealthy has made me want to provoke change.
By having a positive attitude, a balanced diet and lifestyle, and leadership in the community. I want to make an impact on what my community eats, so my people can be healthy people.
My name is P. I'm from Odessa, Texas. Being part of the 74% that don't exercise, I want to change this.
My name is Yemi Sinesio from Omaha South. My goal is to get kids to get up and get active, to be saludable.
So why don't you join me and the Saludable team, and let's all get active.
Hi, I'm Joe, and I'm from Southern California, and I'm also part of Saludable. You need the right attitude to balance out your lifestyle, both physically and mentally. You've got to lead others to make an impact on those around you. And with your newfound energy, you'll be able to kickstart your healthy lifestyle.
And get active.
Saludable is all about reaching into the Latino community and showing them a achievable, sustainable, and fun way to a better lifestyle.
We need to target policymakers who can influence our food industry. I personally want to inspire my community to not only see what's in front of them, but to have the knowledge and courage to challenge it.
Saludable's leadership will show by example that Latinos can live a more energized and happy life.
To do all that, you need to have lots and lots of energy. We believe in you. You can do this.
It's time to face our reality and move forward together.
So I'm taking part in Saludable to help kickstart a new generation of healthy Hispanics in America.
So that's from the first class that helped develop the brand and help launch the brand. And as I mentioned, because we're now in the school, every year there are going to be a small group of new students joining the movement. And some of those graduates continue to be involved. In fact, we hired Joey, who was one of the person shown in the video, back as a part-time community liaison. I'm just going to show you very quickly, if you click on the second tab, please. Heather, the second tab on top. Yeah. And then the left-hand corner, left-hand bottom corner, the other one. Let's just play the first minute and the last minute. This is Joey and Danny are musicians, and so we're capitalizing on their talent, and they wrote an original song for this movement.
Hi, my name's Joe, and my passion in my life is music, and I really want to be part of this group because I want to help save people's lives and change people's lives through music. It kind of does. Where we like have like cheesy, healthy Power Rangers sort of thing. Food? And like we all turn into a different fruit or vegetable.
Wouldn't that be G?
It's Morbid time. Turn in
So we tell all of our stories through videos and photos online.
I lost my grandpa when I was 7. He died of diabetes. He had a leg amputated, and it actually passed on to my dad. It runs in the family basically, and my dad has type 2 diabetes, and he pricks his fingers, and he has to take medicine, and I mean, that's like my hero. That's my dad's like the big guy. I mean, I never see him cry. He's just always been a rock, and he's always been there for me.
There was not one single student in our first cohort whose family was not affected by diabetes. It was remarkable. You can go to. This is at one of our public launch events. The students have created these artistic drums to auction off. And this is the theme song that Joey and Danny wrote for the movement. So, running out of time, I think we'll end there. But the whole idea is to really marry media, social marketing, and community partnerships in order to begin creating this movement. And hopefully one day we can be as popular as Moms Rising. Thank you.